The job description of a pediatric nurse focuses on the specialized care of infants, children, and adolescents. These healthcare professionals are trained to assess, monitor, and treat young patients while offering emotional support to their families. Pediatric nurses work in a variety of healthcare settings, including hospitals, clinics, schools, and community health organizations. Their role is essential in delivering compassionate, developmentally appropriate, and age-specific nursing care that promotes healing and healthy growth. Pediatric nurses collaborate closely with pediatricians, nurse practitioners, and other members of the healthcare team to administer treatments, manage patient care, and educate families about preventive health. Their responsibilities go far beyond clinical procedures. They are also advocates, educators, and key emotional support figures in the lives of both the children and their families. The ability to build trust with children and their caregivers is central to the success of a pediatric nurse. Because they deal with patients who may not always be able to fully express their needs, pediatric nurses must be skilled in observation, communication, and quick decision-making. They often work under pressure and in emotionally charged environments where the stakes are high and the needs are complex. Whether treating a minor injury or managing a chronic illness, pediatric nurses play a critical role in a child's healing journey. Core responsibilities and daily duties. A pediatric nurse's day-to-day duties are both varied and demanding. Their first responsibility is to assess patients upon arrival, checking vital signs, reviewing medical history, and gathering information from parents or guardians. Because symptoms in children can present differently than in adults, pediatric nurses must be skilled at recognizing signs of illness even when a child cannot clearly articulate what's wrong. Once assessments are complete, pediatric nurses administer medications, vaccines, and other prescribed treatments. They are often responsible for setting up IVs, drawing blood, and managing pain through both medical and non-medical methods. Communication with young patients is essential here, as nurses must explain procedures in ways that children can understand and feel safe with. Pediatric nurses also play a significant role in monitoring patient progress. This includes charting information, observing for changes in behavior or condition, and reporting concerns to doctors or nurse practitioners. In neonatal or pediatric intensive care units, NICU or PICU, this monitoring can become minute to minute, as young patients in critical care require constant attention. One of the defining features of the pediatric nurse role is family involvement. Unlike other specialties, pediatric care always includes working with the child's caregivers. Pediatric nurses provide guidance on medication schedules, dietary needs, symptom monitoring, and home care practices. They answer questions, calm fears, and often become trusted sources of comfort and support during difficult times. Another key aspect of this profession involves health education and disease prevention. Pediatric nurses teach both children and their families about hygiene, nutrition, immunization, and overall wellness. They may provide resources or referrals to social services when necessary, especially in underserved communities. Depending on the work setting, pediatric nurses may also assist during pediatric surgeries, coordinate rehabilitation therapies, or work in pediatric oncology units where treatment regimens are complex and long-term. Their role adjusts according to the level of care required, from primary wellness visits to end-of-life care in pediatric hospice environments. As we move into the middle of the discussion, it becomes clear that the job description of a pediatric nurse demands not only clinical expertise, but also emotional intelligence, adaptability, and patience. These professionals are uniquely trained to understand both medical science and child development, enabling them to offer care that is both technically sound and emotionally appropriate. Skills and attributes for success. To thrive as a pediatric nurse, a specific combination of hard and soft skills is necessary. First and foremost is communication. Pediatric nurses must speak clearly, kindly, and often creatively to children of varying ages and developmental stages. They must also be excellent listeners, attuned to what children say, what they don't say, and how their nonverbal cues communicate discomfort or distress. Empathy and patience are crucial attributes. Children may be frightened, confused, or in pain, and their reactions can include crying, anger, or withdrawal. A successful pediatric nurse knows how to comfort and distract, using humor or storytelling to gain trust and cooperation. Attention to detail is another essential skill. Pediatric medication dosing, for instance, often depends on the child's weight and age and must be calculated precisely. A small error in dosage or timing could have serious consequences. Monitoring subtle changes in behavior or physical appearance is also critical in pediatric care. Cultural sensitivity is especially important in pediatric nursing. Families come from diverse backgrounds and may have different beliefs about medicine, parenting, and care. A respectful, open-minded approach allows nurses to meet families where they are and build strong, trusting relationships. Technical proficiency with medical equipment is expected. Pediatric nurses must be familiar with devices such as nebulizers, oxygen masks, feeding tubes, and pediatric monitors. They must also stay up to date with current protocols, guidelines, and standards of pediatric care. Teamwork is a cornerstone of this field. Pediatric nurses coordinate closely with doctors, respiratory therapists, social workers, and other nurses. Their ability to communicate effectively and advocate for their patients within an interdisciplinary team can significantly impact outcomes, work environment, and common challenges. Pediatric nurses work in dynamic, fast-paced environments. Whether in a bustling emergency department or a specialized children's hospital wing, they must juggle multiple patients and respond quickly to changing priorities. The work is both physically demanding, requiring long hours, standing and lifting, and emotionally intense. One of the most challenging aspects of the job is witnessing children suffer. Pediatric nurses must support grieving families, deal with difficult prognoses, and occasionally cope with the death of a patient. Emotional resilience and access to mental health resources are essential for long-term success in the field. Despite the challenges, many pediatric nurses find deep fulfillment in their work. The opportunity to make a tangible difference in a child's life, help families navigate complex medical systems, and witness moments of joy and healing keeps many dedicated to the profession for years. Compensation for pediatric nurses varies based on location, experience, and the specific healthcare setting. In general, they earn competitive salaries, often with additional benefits such as health insurance, paid time off, and continuing education support. Pediatric nurses who pursue advanced degrees or certifications, such as becoming a pediatric nurse practitioner, PNP, may take on expanded roles and increased responsibilities, along with higher pay. Education and career path. To become a pediatric nurse, one must first earn a registered nursing RN license, typically through an associate or bachelor's degree in nursing. After passing the NCLEX RN exam, aspiring pediatric nurses often gain experience in general nursing before moving into pediatric units. Some hospitals provide specialized training programs or pediatric residencies to prepare nurses for the transition. Certification as a certified pediatric nurse, CPN, is not always required but can enhance credibility and career prospects. This certification, offered by the Pediatric Nursing Certification Board, PNCB, demonstrates specialized knowledge and commitment to the field. Many pediatric nurses pursue advanced practice roles, such as pediatric nurse practitioner, PNP, or clinical nurse specialist, CNS, in pediatrics, which require graduate-level education and national certification. These advanced roles offer opportunities for leadership, independent practice, and specialization in fields like neonatology, cardiology, or oncology. Conclusion. The job description of a pediatric nurse highlights a role that is as challenging as it is rewarding. These professionals blend clinical expertise with compassion to care for the youngest and most vulnerable patients. From monitoring vitals and administering treatments to educating families and offering emotional support, pediatric nurses are vital members of the healthcare team. For those drawn to a career that requires empathy, precision, and a deep love for working with children, pediatric nursing offers a powerful and fulfilling path. Whether supporting a newborn in intensive care or guiding a teen through chronic illness management, pediatric nurses make an impact that lasts a lifetime, not only in the lives of their patients, but also in the hearts of the families they serve.